prostate cancer, is close to me. My father had prostate cancer, and prostate cancer disproportionately affects African Americans and men of Jamaican descent, of which I'm both. So in that way, prostate cancer is a focus of mine because it hits close to home. But my practice in general is focused on keeping people well, and ideally preventing. With prostate cancer, it's not clear what specifically can be done to avoid prostate cancer other than the things that we already know are good for your overall health, and that's exercising regularly, eating more fruits and vegetables, and avoiding alcohol and smoking, and maintaining a normal body weight. All of those things, if you do all those things, you do reduce your risk of developing prostate cancer. But because so many men are at risk of developing prostate cancer, and the vast majority of those will not be impacted by the cancer, there has to be another way than a very aggressive approach with surgery and radiation for everybody with cancer that leaves so many people with a poor quality of life. And that's really why we looked into or have been looking for ways to better gauge risk for men so that they can more accurately and more confidently make the decision about their treatment. So the PCA3 test was one of the first tests we found out about. It's only been approved for 2 or 3 years in this country. It was developed in Europe. And in the study that they used to validate the test, they're measuring a very specific a protein that's produced by the prostate cancer cell. So the more you have, the more likely it is that you have cancer. And they found that the cutoff was 35. So if your test result was below 35, you had a very low chance of having a positive biopsy. And when the test came here for approval, the decision was made to reduce that cutoff with the idea that you want to be sure that you capture as many prostate cancers, even at the risk of having some false positives. So they reduced the cutoff from 35 to 25. And here's, if you're below 25, you have a low risk. If you're above 25, you may have a higher risk and probably then should have a biopsy.